The other approach used in guidance counseling is the humanistic approach. It has three types: the person-centered therapy, the Gestalt Therapy, and the Existential Therapy. So, what is humanistic approach? Okay, when we talk about humanistic, it came from the root word human. So, individual, person, people. It concerned with human potential and individual unique personal experiences. So, unique. So, a potential of each one of us, our own experiences. This is not based on the others, but it's based on your own. It is holistic because it includes and accepts various theoretical traditions and therapeutic practices. It assumes interrelatedness between the client's psychological, biological, social, and spiritual dimensions. It assumes that people have an innate capacity toward self-understanding and psychological health. The role or roles of the counselor in humanistic approach is they do not deny the importance of many principles of behaviorism and psychoanalysis. So there are different kind of learning theory or behavioral theory. So there are different bases for them to help the client. They value the awareness of antecedents to behavior as well as the importance of childhood experiences and unconsciousness psychological processes. So they give impact on the childhood experiences and our unconscious mind. So diba, there are instances na we think something that we don't know or we are not aware of. So maybe these are the attitude or characteristics that we had when we were young. Okay? They believe that humans are more than the collection of behaviors or objects of unconscious forces. The goals of therapy is to help individuals access and understand their feelings, gain a sense of meaning in life, and reach self-actualization. So, self-actualization, it is the highest peak of the Karl Marx human needs. So, self-actualization. To help the client develop a stronger, healthier sense of self. So, if we talk about humanistic approach, it really focuses on the individual or ourself to be more rational, more objective in our way of thinking, focus on how we deal with our feelings, and give meaning of our existence. Okay, it helps clients remove and replace the attitudes, behaviors, and beliefs that do not produce a positive state of being, and integrate the various components of their unique personalities so that each individual is more self-aware, mature, and authentic. So in this kind of approach, so the goal of it is to remove and replace that attitude that hinders their self-awareness, that hinders their being authentic or being mature, and hinders their way of understanding themselves or themselves. Okay? So there are three therapy includes in humanistic approach. The first one is the person-centered therapy, or also known as the client-centered therapy. So it was introduced by Carl Ramson Rogers in 1940. The therapy is based on Rogers' belief that every human being strives for and has the capacity to fulfill his or her own potential. It also known as Rogerian therapy, has a tremendous impact on the field of psychotherapy and many other disciplines. So focus on this person-centered is a person will able to understand and learn their benefit, their importance of their life, or the reason why they were living. And also they can do things. Person-centered therapy uses a non-authoritative approach that allows clients to take more of a lead in discussions so that in the process they will discover their own solution. So the therapists act as a compassionate facilitator, listening without judgment and acknowledging the client's experience without moving the conversation in another direction. So mostly in this part, the therapists are listening and understanding the situation of the client without even judging them, why they tend or why they come up with that decision in life. The therapist is there to encourage and support the client and to guide the therapeutic process without interrupting or interfering with the client's process of self-discovery. So, if it's all person-centered, no, the therapy session is on focus on learning ourselves in our own way, but also with the guidance or with the guidance of the therapist. When it's used, anyone who would be better off gaining more self-confidence, a stronger sense of identity, and the ability to build healthy interpersonal relationships and to trust his or her own decision. It used alone or in combination with other types of therapy can also be helpful for those who suffer from grief, depression, anxiety, stress, abuse, and other mental health conditions. Person-centered therapy works with both individuals and groups. So it applies on individuals and groups. The client must do a lot of the work in the person-centered therapy. Those who are more motivated are likely to be more successful. So in this person-centered therapy, the process of the therapy session are more on the client part. So just the therapist only facilitate what are the activities, what are the things that the clients must do. But all of the things are on the discovery of the client. What to expect? Talk therapy means the client does most of the talking. So person-centered therapy, so focus on the client. So all the things are given by the client. So just therapists are the good listener. Your therapist will not judge or try to interpret what you say, but may restate your words in an attempt to fully understand your thoughts and feelings. So rephrasing to have a more understanding meaning of the things that the client would say or will say. When you hear your own words repeated back to you, you may then wish to self-edit and clarify your meaning. So that is why the client, or no, that is why the therapist restate the things that the client said, so that the client are all aware of their way of thinking, so that it is a way of realizing their own mistakes. What to expect? This may happen several times until you decide that you have expressed exactly what you are thinking and how you feel. There may be moments of silence to allow your thoughts to sink in. This client-focused process facilitates your self-discovery, self-acceptance, and it provides a means toward healing and positive growth. How it works. So we know that person-centered therapy is also known as Rogerian therapy, originated in the work of the American psychologist Carl Rogers, who believed that everyone is different and therefore everyone's view of his or her own world and ability to manage it should be trusted. So because in person-centered therapy, it, it believe or they believe that everyone has a unique characteristics. Roger believed that all of us have the power to find the best solution for ourselves and make appropriate changes in ourselves. So, self-directed. So, our mistake, our solution. So, the clients or the therapist will help us to think that way. In person-centered therapy was a movement away from the therapist's traditional role as an expert and leader toward a process that allows clients to use their own understanding of their experiences as a platform for healing. The success of person-centered therapy relies on three conditions. First, unconditional positive regard, which means therapists must be empathetic and non-judgmental to convey their feelings of understanding, trust, and confidence that encourage their clients to make their own decisions and choices. Empathetic understanding, which means therapists completely understand and accept their clients' thoughts and feelings. Next is congruence, which means therapists carry no air of authority or professional superiority, but instead present a true and accessible self that clients can see is honest and transparent. So congruence, so the client see the therapist as honest person and transparent, a person that can be trusted. What to look for in a person-centered therapist. So if we talk about person-centered, so you must have a license. You are licensed mental health professionals from a variety of disciplines called training and experience in the Rogerian approach. Can use person-centered intervention instead. Okay? Also, in addition to finding someone with the educational background and relevant experience, look for a therapist or counselor who is special empathetic and with whom you feel comfortable discussing personal issues. That will be all about person-centered therapy. So if we talk about person-centered therapy, it focuses on the self-actualization, understanding your own personality and your own potential, and understanding your own mistakes and trying to find ways to find solution on your own. Okay, the second one is the Gestalt Therapy. So, it was introduced by the Friedrich Salmon Pearls. It was developed as a revision to psychoanalysis and focused on the experiential and humanistic approach rather than analysis of the unconscious. It rejects the dualities of mind and body and soul, thinking and feeling and action. People are not made of separate components rather than human being function as a whole. So, meaning he believe that therapist uses this kind of therapy believe that human being function as a whole, not only one or two components of ourselves, but as a whole. One defines who one is sense of self by choice of responses to environmental interaction or boundaries. Gestalt means whole configuration, integration, pattern and form, according to Patterson 1986. The self-awareness is key to personal growth and developing full potential. So it is part of the humanistic approach, so they are focused on the self-awareness or learning your own, understanding yourself, what you can do, what you can't do. It aims to promote a non-judgmental self-awareness that enables clients to develop a unique perspective of life or on life. These are the following scope that we will discuss about the Gestalt Therapy. The first one is basic philosophy. Gestalt Therapy strives for wholeness and integration of thinking, feeling, and behaving. So, work as a whole. So, wholeness, not only the feeling, not only our way of thinking, not only our behavior, but the wholeness of it that involves in ourselves. It concerned to be a here and now therapy, focusing on awareness with a belief when one focuses on what they are and not what they wish to become. They become self-actualized. Naturally seeks to become an integrated whole, living productively. So, in this part, or Gestalt Therapy will help the client understand themselves. They are anti-deterministic. They believe that people have the ability to change. Gestalt focus on the client's own inner world of interpretation and assessment of the present life situation. Also, they believe that individuals emphasize intellectual experience diminishing the importance of emotion and senses. So emphasizes on the intellectual experiences. Also, they believe that thoughts, feelings, and reaction to past events or situations can impede personal functioning and prevent here and now awareness. Or it can help them from the past, they can learn how to react on the present situation. The key concept of Gestalt Therapy, it focuses on the wholeness and integration, awareness of ourselves, energy and blocks of energy, growth disorder, unfinished business. The role of the counselor, it creates environment for the client to explore their needs in order to grow. Fully with the client in the here and now with intense personal involvement and honesty. So yes, to gain the trust from our client, we must be honest and reliable for them to open up. Help the client to focus on blocking energy and to positively and adaptively uses that energy. So blocking energy, the negative thoughts. So they will use that. They help the client to understand, to help them use it positively. Helps the clients to discern life patterns. The goals of therapy are to assist clients in gaining awareness of moment-to-moment experiencing and to expand the capacity to make choices. The moment-to-moment, the here and now, the present situation, the present experiences. Focus on clients' here and now experiences. So focus on the present. Encourage to make choices based on now as opposed to past. So make choices based on now. So don't make a choice that based on the past. Example, mali yung desisyon mong ginawa sa nakaraan. So it hinders you to think positively or rationally in the present. Kasi iniisip mo na parehas lang yung mangyayari. Same pa rin. Walang mangyayari. So, yun yung mindset mo. So, in this Gestalt Therapy, it will help you to oppose from the past. So, make a choice because past and the future and the present are different. So, you can make your own choice or own decision in a certain problem that you are faced on. Help client resolve the past. Assess the client to become congruent. Help client reach maturity intellectually, being matured, think rationally, objectively. Help client shed neurosis. The therapeutic relationship, the central importance given to the I, the relationship, and the quality of the therapist's presence. Therapist's attitudes and behavior counts more than techniques used. So they are focused on the attitude of the therapist. If they are reliable, honest, to be trusted, so that is the most important than the technique used by the therapist. Assess them in developing the means to make their own interpretations. Clients identify and work on unfinished business from the past that interferes with current functioning. The techniques of the therapy in Gestalt has two forms, an exercise or an experiment. So number one, exercises include activities such as frustration actions, fantasy role-playing, fantasy, and psychodrama. The second is the experiments, are unplanned creative intervention that grow out of the here and now interactions between the client and the counselor. We also have dreams, empty chair, confrontation, making the rounds, I take responsibility, exaggeration, may I feed you a sentence? Okay, these are the possible techniques that you can use in the session or in the therapy session using Gestalt Therapy. Application: to help individuals gain a better understanding of how their emotional and physical needs are connected. This journey of self-discovery makes the approach beneficial for individuals who can be guided when it comes to their emotions and find it difficult to process why they feel and act the way they do. It can also provide support and a safe space for individuals going through times of personal difficulty. It's valuable for helping to treat a wide range of psychological issues. It's effective for managing tension, anxiety, addiction, post-traumatic stress, depression, and other psychological problems. Effective in groups, couples, and families counseling. People who participate in Gestalt therapy tend to be more self-confident, calm, and at peace with themselves. So Gestalt therapy is very good in the anxiety and managing tension. So we can gain more self-confidence and calm. So we can find peace at ourselves. Multiculturalism, focus on expressing oneself non-verbally, is congruent with those cultures that look beyond words for messages. It can help overcome language barrier with bilingual clients. So they are showing more on action than words. Focus on bodily expression is a subtle way to help clients recognize their concepts. Contribution in the field of therapy, psychology, it emphasizes on direct experiencing and knowing rather than on merely talking about feelings. It provides perspective and growth and enhancement, not merely a treatment of disorders. It's viewed as an existential encounter. It is process-oriented. Recognizes nonverbal behavior as the key to understanding. So more on the action. They focus on the action for the development of the client behavior. It has the limitations. The therapist must have a high level of personal development. So by Corey, 2005. Limited in effectiveness of the confronting and theoretical techniques. Self-centered approach. Lack of strong theoretical base because, yes, it was said that the attitude, the feelings that the client attached to the counselor is more effective or more important than the techniques used in the therapy session. Deals only with the here and now. So the present does not deal with diagnosis and testing. That would be all about the Gestalt Therapy. So focus on the self-awareness, focus on the here and now. So the next one is the Existential Therapy. Okay, these are the two therapies or psychologists involved in this kind of therapy. Royal Rees May and Dr. Victor Emil Frankl. Existential psychotherapy uses positive approach that applauds human capacities while maintaining a genuine perception of the limitation of the human being, human spirit, and human mind. These are the things that we will discuss. The basic philosophy. Existentialists believe that the individual writes their own life story by the choice that they make. Yes, we know that we are making our own story. We're making our own life. We're making our own decisions in life. Psychopathology is defined as existentialists as neglecting to make meaningful choices and accentuating one's potential. Anxiety is seen as the motivational force that helps the clients to reach their potential. So meaning it can be motivational. So it uses a past negative reinforcement. So being in an anxious state of mind, it can help them gain more. It can help them gain more about their potential, their what they can do. Frankl shares that each person searches for meaning in life. Life meaning can be discovered in three ways, according to Frankl. By doing a deed, accomplishments, achievements. By experiencing a value, beauty, love, nature, and arts. By suffering, reconciling ourselves to fate. Key concepts. Humans are in a constant state of transition or change, emerging, evolving, and becoming. Being a person implies that we are discovering and making sense of our existence. The basic dimensions of the human condition include the capacity of self-awareness, freedom and responsibility, creating one's identity and establishing meaningful relationship with others. 4. The search for meaning, purpose, values, and goals. 5. Anxiety as a condition for living. 6. Awareness of death and non-being. What is the role or roles of the counselor? Client's unique relationship with the counselor, being authentic with the client, deep personal sharing. Counselor models how to be authentic. So, this essential therapy focuses on being true to yourself, authentic, without any bias. Your being of who you are, the real personal potential, and to make decisions with emphasis on mutuality, wholeness, and growth. They do not diagnose, nor do they use assessment models like DSM-4. The goals of therapy is to have the client take responsibility for their life and life's decision. So yes, it focuses on the no matter what decision you make in life, it's your choice. You must live with it. So don't blame other because it's your choice. We have a freedom to choose. To develop self-awareness, to promote potential, freedom, and commitment to better life choices. To develop an internal frame of reference. To identify factors that block freedom. Successfully negotiate and come to terms with past, present, and future crises. Become more truthful with themselves. Find clarity on what their purpose in life is and how they can learn from the past to create something valuable and meaningful to live for. Next is to understand themselves and others better and find ways of effectively communicating and being with others. The therapeutic relationship, the therapist's main tasks are to accurately grasp clients' being in the world and to establish a personal and authentic encounter with them. The clients discover their own uniqueness, so able to learn themselves, learning who they are, learning what they can do. Both the client and therapist can be changed by the encounter. The techniques of therapy, it stresses understanding first and technique second. The meaning, the first focus on the client, personal life, learning them, understanding them, what they can do, what they like, what they want, before using techniques to help them understand or gain self-awareness. The therapist can borrow techniques from other approaches and incorporate them in an existential framework. Confrontation used by existential counselor when they challenge the clients with their own responsibility for their lives. Therapeutic procedures. The therapy is a creative, evolving process of discovery that can be conceptualized in three general phases. Initial phase, identifying and clarifying their assumption about the world. Middle phase, encourage to more fully examine the source and authority of their present value system. The final phase, take what they are learning about themselves. Applications. It is appropriate for clients who are struggling with developmental crisis, doing grief work, confronting death, or facing a significant decision. Can be applied to both individual and group counseling, marital and family therapy, crisis intervention, and community mental health work. Multiculturalism focuses on understanding clients' phenomenological worth, including cultural background. It leads to empowerment in the oppressive society. It can help clients examine their options for change. Its major contribution is recognition of the need for the subjective approach based on the complete view of the human condition. It calls attention to the need for the philosophical statement on what it means to be a person. Stress on the I-thou relationship lessens the chances of dehumanizing therapy. It provides a perspective for understanding anxiety, guilt, freedom, death, isolation, and commitment. The limitation of this existential therapy is it can be criticized on the grounds that they are excessively individualistic. They ignore the social factors that cause human problems. It is highly focused on the philosophical assumption of self-determination, lack of direction that clients may get from the counselor. That would be all about the humanistic approach. And now we will tackle about the different or the other techniques or approaches uses in the guidance counseling.